Look, surgery is straight up scary, especially if you haven't had one before. I remember before my first surgery, I was so nervous and scared, but it was mainly because I just didn't know what to expect. So if you or someone you know is about to have some type of pelvic surgery for your woman's health issues, this is the video to share with them. Unfortunately, I've had a lot of surgeries since then, so I've picked up a lot of tips and tricks that I can share with you. You might be surprised at what your doctor's office and the hospital forget to tell you or just don't think to tell you. So that's why I'm here. So first off, what to expect. Now you're most likely going to be having some form of laparoscopy, either with or without the robot. In the past, there were a lot of laparotomies done where you would have just a big scar down there. It was a lot more invasive, but now a lot more doctors have learned how to use the robot. That's good news for us because it's less invasive, faster recovery time, and much smaller incisions. If you're having a surgery with a NAPRO technology doctor, your first surgery is going to be a minor laparoscopy without the robot. It's just an incision in the belly and a couple inches down. They don't use the robot. Then if you need another surgery, then you'll have the robot. If you're having the robotic surgery, you're gonna have 5 incisions all along the belly button line. They've been in different locations for me. I think it just depends on what they're dealing with specifically inside of your belly. I can't speak for mainstream gynecology so much because it's been several years since I've had a surgery with them. I'm sure they use the robotic surgery too, but I know that they do things a little bit differently. So I don't know where they are with that now. But again, they're only gonna resort to the laparotomy in rare cases. At your pre-op, they're really just gonna draw your blood and ask you a lot of questions about your medical history. They'll also give you some form of instructions on how to clean yourself the night before surgery. I've sometimes been told to take one shower the night before, and then other times I've been told to take a shower before I go to sleep, and then in the morning when I wake up right before I leave for surgery. I've also been told to buy antibacterial soap at the store and just use that to bathe with. Then other times I've also been giving some super special fancy stuff to bathe with the night before to clean off just on your body, and then they tell you which areas to avoid when I'm taking my shower. And then I've also been given these wipes in a package where you scrub down all the surfaces of your body outside of the shower. But sometimes they just give you those when you get to the hospital the next morning before your surgery to scrub down with. And that part's not bad. Another part that's kind of uncomfortable is the day before you have to do some sort of cleanse. I've had it a couple of different ways, whether it's through an enema, which is uncomfortable, but it's better than drinking that nasty stuff. But I also have had to drink the nasty stuff. It just depends on how much they need to empty your bowel, and that's just in case they nick your bowel or something. They want it to be all clean so that you don't get an infection in there. That would be really bad. So although that's uncomfortable, it's definitely worth it. It's not something that is unnecessary. So moving on to when you go into the hospital, usually they tell you to get there 2 hours before surgery, and you meet a nurse who comes in and puts your hospital band on. They take your vitals, they tell you to take off all your clothes, and they give you a hospital gown to put on. Then you lie in the bed, and there's a lot of waiting if you get there on time, usually. And then at some point, you'll just be greeted by a lot of different people. The nurse will at some point come in and start your IV and hang you some fluids, most likely. And then you'll get a visit at some point from your doctor. Also, if your doctor is having another doctor or resident or somebody they're teaching, some type of assistant, they'll usually come visit you too. You're gonna get a visit by the surgical nurse who is just going to ask you some questions to make sure they have all information that is important to know about you beforehand. This is also a very good thing. Also, the anesthesiologist and the nurse anesthetist will come visit you just to make sure they have all important information. Again, that's also really important. And those are the main people. And then if there's anybody else that's important on your surgical team, they'll come in and talk to you, and just, it's nice to meet them. They help you to feel more comfortable. If you have any questions, that's the time to ask them. Right before they wheel you off to surgery, either the anesthesiologist or the nurse anesthetist will come and give you some happy medicine through your IV to help you to relax as they wheel you into the operating room. They'll have you, and now every time I've done it, they have had me just get onto the other table, and then shortly after that, you drift off into happy sleepy land until you wake up from surgery. So here are some of the tips that I felt were most helpful to me. So number one, wear comfy pants, something with an elastic waistband or something, because obviously the waistband is going to be sitting very close to your incisions, but also whenever you come out of surgery, you're a bit swollen right here, kind of looking like you're a little bit pregnant. So you don't want to wear jeans or something that doesn't give. Now, the clothes that you take off, they're going to give those back to you when you're ready to go home. So that's why you want to wear something that is comfortable. Number two, pack up some things like deodorant, chapstick, or even some baby wipes. And if you're going home the same day from your surgery, this is a little less important, but you can still do it. Definitely if you're staying overnight, because when you go into surgery, they tell you don't wear deodorant, lipstick, makeup, nothing. You can have nothing. So oftentimes afterwards, I have felt what it's like to not have deodorant, and it's so uncomfortable, annoying. Also, if your lips get a little bit chapped, the chapstick will help with that. If you just feel unclean, the baby wipes help, or face wash wipes. Last time I got some of those cheap travel face wash wipes, because you know they close your eyes, they tape your eyes shut during surgery, or like, I don't know, you have some, I don't know where this stuff comes from, but you get like things, sticky things on you. It's just nice to have something that you can use to wipe that off. And sometimes the hospital has stuff, but it's just nice to have your own things from home sometimes. Also a toothbrush for sure. If you're staying overnight in the hospital, bring your own toothbrush. Anything you can think of that you might need to be with you, just life's little essentials. Number three, now I have in the past been told don't shave closer than a week before surgery, but I've also not been told that. So I don't know the significance of that, other than your pores are open, and I know that if you're using those wipes they give you to disinfect your body before surgery, it really burns, and they tell you don't use it on areas you've shaved in recently. So just to be safe, I shave no closer than like 3 or 4 days before surgery, and that's legs, underarms, you know, things like that, arms. Just go ahead and do that. Don't wait to do that for the night before surgery, just to be safe. Next, I think this is the most valuable tip that I have learned. So you don't know where they're gonna start your IV. It could be your hand, it could be near your wrist, it could be right here, it could be on the back of your forearm right there. So what I do is I make sure to shave my arms. I shave my arms already, but not that frequently. I shave the area where they're possibly going to put the IV, because they put the sticky tape or like clear bandage over it to keep it in place. And when they go to rip that off, in the past, I have not been shaven, it really hurts. So you're already in pain and uncomfortable from surgery. It's just something little like that that can really make it go by a lot easier. So just go ahead and shave each part, because you don't know where they're gonna find that perfect vein to stick you in. Also, I talked about how you're gonna have incisions along the line of your belly. I also like to shave all areas where I could possibly have an incision, because it's possible you could have bandages there that you're gonna be changing after surgery. Now, in my most recent surgeries, I haven't had bandages. This must be a new thing that they're putting this clear surgical gel over the incision, which I love. It's so much better than having a Band-Aid. It is an awesome advancement. You don't have bandages when you wake up from surgery with this. You just have this clear gel over. It lasts for 2 weeks. It's some hardcore stuff. It starts to fall off on its own, or they say after 2 weeks you can just kind of pick it off. But you can see what's underneath, so it's really helpful. And you don't have to be changing the Band-Aids. Now, if for some reason they don't use that surgical gel, or they can't, for example, I had surgical gel on all of my incisions this last surgery, but they didn't cover it up all the way and I was bleeding, so they ripped it off after surgery. So I had one incision that was open that did need a Band-Aid. So this goes into my next tip, number 5. If you are going to have Band-Aids, which you don't know if you're going to have necessarily beforehand, cut the edge of the Band-Aid where the sticky part is. Not all the way, you want just a little bit. But because you're gonna be removing those Band-Aids and likely replacing them, the skin gets really raw underneath it. So you're just decreasing the surface area of the sticky part so it doesn't take up as much of your skin. And don't change them too often. You don't need to be changing them several times a day. Just make sure to keep the area around it clean. Next, ask for TED hose or compression stockings and or SCDs beforehand. Here's the story behind that. The TED hose is just those white compression stockings. You can get them up to your knee or up to your hip, and it helps prevent blood clots. The SCDs do this as well. Now, every surgery I've had, they've had the SCDs on me during surgery, and then they leave them on if you're staying overnight. Not all of them will give you the TED hose. Now, I know it's not mandatory for hospitals or anything, especially if you're young. It is not likely, it is rare to have, that was a bird flying very close to my head. It is very unlikely that this will happen, a blood clot or anything. I just like to ask for them just to take precautions. And then I like to leave them on once I leave the hospital because you're not moving around a lot right after that. So I like to have them when I sleep for the next couple of days, and then I take them off and I throw them away. The last time this happened, the hospital just before, well, I shouldn't say that. The operating, when they prep you for the operating room, they didn't have TED hose. So I just went in with the SCDs. But I stayed overnight, and the room or the department they moved me to did have the TED hose, or they could order it for me. So they just ordered it for me, and they didn't wear them in the hospital, but I took them home with me, and I just wore them then. You know, if they don't have them, no big deal. But if they do have them, it is something you can ask for, and I just want you to know that. If you get nauseous easily, I know this from the past when I've had surgeries, I got really nauseous. So every time they usually ask you these things, but just in case they don't, you can tell them you get nauseous easily. They'll give you some extra meds before going into surgery, and then also coming out. It's just good for them to know. But they also can put the little patch behind your ear to help also to prevent nausea, and you keep that on for 3 days or so. So they put that on before wheeling you into surgery. Number 8, the anesthesia and pain medicine can make you very constipated. So getting ahead of this is really gonna help. Drink as much water as you can after surgery. When they allow you to drink water and you feel like your stomach can handle it, drink a lot of water. There's also supplements that you can take. Just make sure you clear it with your doctor or the hospital nurses first, that whenever you can start taking some sort of fiber supplement or stool softener, the sooner you can get ahead of that, the easier it's gonna be when your system starts moving again and you do start using the bathroom, because you don't wanna be straining, especially after surgery, especially with all your incisions and everything they did inside. Also, a diet that's high in fiber. If your doctor says it's okay, you can eat fruits and vegetables a lot. That's gonna help you. Now, something that I use that I like is Benefiber makes them. I've also seen just store brands make them, but it's a little powder. It tastes really good. It's like, it comes in strawberry kiwi. But you just put it in a water bottle, shake it up. It's a really good source of fiber that you can use, and you just drink it in a water bottle like once a day. That's often helped me in the past. Number 9, bring your own pads. Lots of times there is bleeding after surgery, and they have pads for you to use at the hospital, but they're just the big and bulky ones. So of course you can use that, but I like to bring my own because they're a lot thinner and a lot more comfortable to use. Number 10, it's just, you can't always avoid it, but you try. But obviously sometimes sneezing and coughing happens, and it hurts like you know what in your incisions and with everything that happens underneath. So the best thing that you can do, grab a pillow, put it next to your stomach gently, hug it, and when you cough, it will make it a little bit easier. If you sneeze, it will help with the pain. I'm not saying it'll take it away, but it will help significantly. Those are my 10 tips. Some other things to think about. You know, the younger you are going into surgery, the faster and the easier you'll most likely heal. Also, the healthier you are. Obviously, we can't take away the fact that there is a recovery period. For me, these surgeries have taken place between the age of 25 and now I'm 32. So I feel like the recovery has really not been that bad. For the more minimal laparoscopy surgeries, it's about 2 weeks, I would say, really. And they'll give you specific instructions on what you can and can't lift up, but I'm just giving you from a patient's perspective. In my experience, I've been able to lay down, and as long as you just avoid touching the incisions and stuff, be careful and limit your walking, it's really not that bad. I feel like other people have it a lot worse. So when you can lie down and just avoid certain movements that cause pain, it's not so bad. So don't be worried too much about that. If you have a robotic laparoscopy, it's gonna be a little bit longer. You're gonna have 5 incisions, and also depending on how long your surgery is and how much they do inside, it's gonna be a little bit longer. I recently had a robotic laparoscopy done, and I would say for that it's closer to 4 weeks, to where you find you're really getting around pretty good. Not that you can get back. I haven't been able to necessarily get back to my normal activity by then, but you're getting around pretty good. Again, you can lie down and usually avoid pain by just not touching your incisions or moving around a lot. The laparotomies, again, those are rare these days. I have had one, and that's the worst by far. 6 weeks, I would say, is how long that takes to where you can really start to move around a lot again. Take it easy as best as you can. We can't always do that, but and working as a PTA, as I've told y'all in the past, we used to always tell patients that when you feel like you're ready to get back to your normal activity, you're really only at about 70%. So it's best, even if you feel like you can get back to doing everything normally, wait just a little bit longer if you can, just taking it easy to where you don't injure yourself anymore. Lastly, something that would have been so helpful to know going into my first surgery that I did not know. My doctor did not tell me this. Your doctor might. But if you don't know this, when you have any type of laparoscopy surgery, they pump you full of gas. So afterwards, now when they try, I know, to push the gas out of you before they close you up and everything. But it's very hard to get all that out. So right after, when you wake up surgery, the worst pain is not usually from the incisions or what they did inside. Now, sometimes that is bad, but for me, the worst pain has been those gas pains, because the gas is trapped inside of you and it needs to get out. Now this sounds weird, but the gas travels up often to your shoulders. That's where I felt most of my pain. I know a friend of mine who had the surgery said the same thing. I think you'll hear that from a lot of people. Also in your chest. So the best things you can do to get that out is to get up and walk as soon as you can. And they'll tell you in the hospital, you're gonna recover sooner if you can get up and walk some. Now don't push yourself too hard, but it is good to get up and be walking around. That helps to get the gas out. Burp and pass gas as much as you can, because obviously that's helping it to escape from your body. A nurse practitioner that I spoke to before surgery once told me that peppermint tea helps, hot peppermint tea, and also ginger ale. So I've gotten that in the past. I don't know how much it helps, but I try whatever I can to get rid of that, to help with that pain, because that lasts a couple of days. Something else, if you can, when you can, it might not be day one, but if you can eventually turn to your left side and lie on that left side, that helps. That has helped me to kind of get the gas to move and push it out of your body. So there you have it. Those are all my tips and tricks for surgery. It's kind of sad that anyone can do a video having that much experience with surgery, but if my experience with multiple surgeries can help you, I am really happy to hear that. Please let me know if you have any questions. You can email me at takingbacktheterms@gmail.com. You can also private message me on Instagram or Facebook, and go ahead and follow me if you want to get some more great information on your women's health issues. And good luck and God bless you. I hope to talk to y'all soon.